Hey guys, it's Adam from Dynamic Training and Rehabilitation and BogartPerformance.com. Today we're going to take you through a little bit of a corrective exercise and soft tissue protocol that we use with guys with adductor dysfunction or adductor pain. In the clinic here we see a lot of hockey players and athletes that come in and they come and say they have a groin pull or they have some kind of groin pain or it goes right up into their pelvic area. Number one, it's usually not the groin itself or the adductor muscle group. It's usually dysfunction somewhere else within the pelvis. If the pelvis is not in line, it's going to put a lot of stress on the adductor. It's usually going to have a lot of pain. It's likely to be overworking the muscle. Say if you have weak glute extensors like your glute max or even your glute min or med, you're going to have a lot of an external rotation causing a big stretch on that adductor group. So we're going to show you some techniques that help balance out your pelvis, strengthen your adductor, and so it takes a lot of pressure off of it so you can perform optimally. First thing we do is a little bit of foam rolling. We're going to foam roll the whole pelvic area, low back, and thoracic spine. So first what I'm going to show you is the quad, a little bit of hip flexor foam roll. So I'm going to lay the foam roll on the ground. You start at your knee straight. You come all the way down, lifting your leg up at the same time. So you straighten it out and lifting it up. A little bit of rotation. Come right up into that pelvis, right up near the ASIS. Once you do about 12 to 15 passes, you can turn on your side so you hit a little bit more of lateralis, or the outside of your quad. Come in, keep 1 foot stable here, rotate all the way down, and come up right into that top hip area. You're going to hit a little bit of TFL and glute med as well. Come right down, and up. Next what we're going to do is the glute. The glute is one of the most important ones to get loosened up. So you're going to do a little bit of extension and rotation. Come right down, add a little bit of rotation, come right up to the top of that iliac crest. Bring it down. So you come right up and back down. Right up. Once you do about 12 passes, you're going to go into the lumbar spine and hit a little bit of QLs. Now a lot of guys don't talk about the QL muscles, the quadratus lumborum. They go from your 12th rib, a little bit of your lumbar spine, right down to your pelvis there. So start off, keep your hands crossed, right at your tailbone, come up until your 12th rib, all the way down. Once you do about 12 passes, add a little bit of rotation, go right in that side, pull your hand across. Hit a little bit of QL. You find a trigger point, kind of sit there for about 30 seconds or so. You rotate to the other side. Last one in the back we're going to do is your T-spine. T-spine is really important to keep mobile. All those vertebrae have to move. Add a little bit of rotation, make sure your rhomboids are opened up by the hug, come all the way down. And all the way back up. Good. Last one we do is the adductor. This is one of the most important ones. We actually do a little bit of knee flexion and extension here to open up all the adductor muscles. So keep your knee foam roll on the side. You start right in your hip here. And you come down, and as you come up into your hip, you're going to straighten your leg. You're going to bring it down. This is going to help separate all the groin muscles, all those adductors, bring off the gracilis and adductor longus. All the way down. Good. Okay. Now with the adductor strain or adductor pull or any pain in that area, you're going to find a lot of tightness in your psoas, which goes here to here, which may rotate your pelvis. So one exercise we're going to do is it's called a dynamic mobilization of the psoas muscle, or it's a dynamic stretch of that psoas major or your hip flexor. So you come in the door. In that lunge here, you're going to grab your leg, one hand on the door, pull your leg up, you're going to rotate your pelvis through, bring it back. Rotate it through, and bring it back. So what we're essentially doing is keeping your core muscles engaged, rotate your pelvis back, bring it through. Try to lengthen that psoas muscle. I'm going to show you 4 exercises to do to help strengthen your glutes, your adductors, and your low back. First one we're going to do is a little bit of a glute bridge. So do a unilateral glute bridge and do a bilateral glute bridge. We use the table right here. So what you're going to do is, on the table, feet flat, your hands on the side, head flat, you're going to thrust your pelvis up, and squeezing your glute cheeks at the very top. Bring it down, back up. Once you do that, we're going to straighten one leg, you're going to come up, straighten it down. Up, so you do about 12 times per side. Up, right up, back down. Next we're going to do is turn over onto your back. Going about a reverse figure 4. So foot right in the back of the leg here, flat down. You'll come up, bring it down. If you can do this pretty easily, or do it so you keep your leg on your knee and rotate your knee out. Side. So first one, up, and down. What I do is you just rotate your knee up. Next one we're going to do is an adductor strengthening here. A lot of guys have weak adductors, and hockey players I work with can't even do this exercise. So be in a figure here, keeping your foot a little bit dorsiflexed. Lay straight down so everything's in a straight line. Bring your legs straight up, back down. Bring it up, back down. About 12 times per second, just feel it all in this leg here. Once you do that, I'm going to add a little bit of glute med on the opposite side. So point your thumb right into that side of your hip here, rotate it up and down. If you want a little bit more glute, turn the foot in, rotate up and down. A little bit of TFL and glute med, rotate that foot up towards the ceiling, up and back down. If that is too easy, you can always put a band around your ankle and do more here. Alright, you got 12 times per side. Remember, this is protocol here for these soft tissue, the dynamic mold, and the strengthening is only for subacute or chronic case of groin pain. If it is acute, get in to see someone, get your pelvis lined up and get all those muscles. It's a little bit of active release or grasping. Good, thanks. That's all I'm going to do.